Hello dear students and welcome to this channel. We have discussed pharmacokinetics in our last video and mentioned that it is the study of what the drug goes through when it is taken by the patient. In this video, we will be discussing the second step of pharmacokinetics, which is the distribution. Distribution can be defined as the movement of the drug from the systemic circulation to the tissues so that it can generate the therapeutic effect. Biochemical properties of the drug and the physiology of the individual taking the medication can affect this step. Those biochemical properties can be the polarity of the medication, also the size of the drug, and also the tissue binding abilities of the drug. While the physiological properties can include the fluid status of the patient as well as the effective drug concentration, which is the concentration of the drug at its receptor site. Volume of drug distribution is a very common method to measure and to describe how drugs are spread in our body. And it is defined as the amount of drug in the body divided by the plasma drug concentration, which is not bound to protein. This volume is useful to compare the distribution of the drug with the volume of theoretical water compartments. Our body is made up of several theoretical compartments, which are the extracellular part, the intercellular fluid part, and also the plasma. So if a drug has a very low molecular weight and it is also hydrophobic, it can be distributed to the total body water including the intercellular volume. While if a drug has a low molecular weight but it is hydrophilic, it will remain in the extracellular fluid. Lastly, if the drug has a very large molecular weight or it binds extensively to plasma proteins, it will only be distributed to the plasma. And here is an image that is showing all of these different parts. If we also mention half-life, it is the amount of time required for serum drug concentration to decrease by 50%. And we are mentioning this because half-life is directly proportional to volume of drug distribution, and any factor that can increase volume of drug distribution can lead to an increase in the half-life of the drug, and this will lead to extended duration of action of the drugs, and then it can lead to serious side effects. Thank you for watching this video. Please don't forget to subscribe to this channel. See you.